Hi everybody, in this short video we're going to be showing you how to complete the consultation sheet with your models. So this is what you're going to need to use for every model in the Academy. The reason for it is to help guide you with your consultation if you're training, but also if you're doing summative assessments. So these are the assessments that you're doing on a model. You'll need to make sure these are completed at the beginning as part of your assessment plan. So starting at the top, we've got learner, that would be yourself. You'll need to make sure that's your full name, so your first name and your last name. With your assessor, that'll be the same. Your assessor would genuinely be Alex, but you'll need to sort of discuss that at the beginning. I'm not your assessor because I am the IQA. So my role in the Academy is to check on the quality and check on the assessors. So I can't obviously be your assessor. So so learning yourself, assessor would usually be Alex, but say do check that. Then you're going to write your models or your guests' full name there, alongside the date, reference number. You only need to reference your summative assessment. So for instance, if you're doing this as a practice, you don't need to reference it. But what will happen is you're going to reference these 1, 2, 3, and from upwards. And what will happen is when you get your assessment logbook, you'll put this next to it. So say, for instance, you did an assessment on a shampoo and a blow dry for units 202 and 204 part A. You'd write 1 here, and then when you go to your logbook, you put in there 202 and 204, but we'll show you that on a separate video. So your referencing must start at 1 and then work up. Your service would be the service that you're doing on the day. So is it a wash and blow dry? Is it a cut? Is it a color? Is it both? So you write that down. The assessment plan, this will vary depending on the course you're doing with us. So this is the hairdressing level 2 apprenticeship. So this is everything from the 702 qualification. So the units are along here. The units are slightly different on the level 2 NVQ, but you can find all this in your induction slides. But also, while you're getting used to this, your assessor can help guide you with what numbers units are, but they are in your induction slides. Very important that you write this out and speak to your assessor at the beginning, because if you start doing a haircut and we don't know, say we being the assessor, and we've had to help you, then that would be a fail, because obviously the idea of an assessment is that you're doing it all on your own. But you will be talking us through what you're doing. If we know it's an assessment, we can then step back. Obviously, we'll just be watching you. If you're about to go terribly wrong, we would obviously stop the assessment and turn it into a training session. And you can be assessed as many times as you want. It's not an issue. This is not the endpoint assessment. This is only used as part of the on-program qualification to help guide you to get to the endpoint assessment. So if you fail a haircut one time, it's not a problem. We can turn it into a training session and then set you up for the next time to do it. So you have to circle which units you'd like to be assessed on. Then you both sign here you sign here as well as your assessor, and that you agree these are the units, what we're going to be assessing you on today. So then you're having a chat to your model or your client, and here are some little tick boxes to help kind of guide you with some of the questioning you might want to use. So for instance, if you're doing a color, you want to be asking do you have any skin sensitivities, any eczema, any problems like this? Do you have any allergies to any color? Incompatible products. So have you used anything on your hair at home? Again, this refers to a color. Have you done any box jobs or anything? So you want to be out these that help sort of probe you some of the questions you'll use. Limiting factors. So these would be things like you want to be visually checking for any hair, skin, and scalp disorders. Checking for their lifestyle. Having a color. Can you maintain it? Can you upkeep it? If you're doing something which is going to require a lot of visits to the salon, and then your characteristics. So the hair's density. So hair density means how much of it they have on the head. Is what we mean by density. So is it sparse, medium, or dense? The texture. So you want to be checking: is it fine, medium, or coarse? So texture means the individual strand and the density means the amount they have on it. So if you're unfortunate enough to have fine hair and it's also sparse, you won't have much hair at all. Whereas it could be you've got fine hair, but it's dense. There's a lot of it. That's one example. And here you need to put the hair condition. Is it dry? Is it damaged? Is it greasy? That kind of thing. Visual aids. So what visual aids are you using with your guests? Magazines at the moment, due to COVID, we're not using magazines. But a color chart could be a visual aid. Style charts, that could be like a Pinterest or something that you've got kind of saved, or a model has brought in with them some features of how I'd like to have the hair. These are the different types of tests that you must complete. You'd always need to do an elasticity and porosity test. So elasticity to check the cortex. So we want to see how strong the hair is. We do that by wetting it down, just one strand, and pulling it to check the hair's strength. Porosity, we do this by feeling the hair. So we're checking for the cuticle. So we're seeing if there's any damage to that cuticle done from drying, overuse of GHDs, these kind of things. So you would generally always check these two. Skin test we only need to do for a colour, same for incompatibility, but you only need to do that if there's any doubt with what they've had before. So Monday we recently had somebody in the salon come in, sorry, so yeah, we had someone come in the salon who had a box job before. They had a henna on their hair, so we needed to do an incompatibility test then. Hair classification, so 1 to 4, so 1 being super straight, 4 being a tight Z curl, very more like afro hair almost. You generally find on 4, 3 with more curly hair. So checking the hair classification and checking the length. So is it one length? Is it layered? So you're going to be checking for these things. Hair growth patterns, so we'll be visual checks for these different types of hair growth patterns there, and also as well as checking the face shape. So obviously use this to help guide with your consultation, but do use this to be asking questions. So don't just sit there in silence with your model as you're taking this. Do use this to help with your conversation with regards to your advice and guidance. So that's for Unit 201 consultation. So you'll need to fill this out of everybody. And then you only need to tick the unit you're being assessed on. So for instance, if you're doing a 203 part A, your cuts, you only tick which hair it is that you're doing. If you're doing a colour only and not cutting it, again, you only need to fill out these. So are we using a demi? Are we using a semi or a quasi? A semi-permanent in a Veda would be your the bright vibrance colours. Your quasi is your demi, is your demi plus. Your permanent is your full spectrum range. Your lightener would be your enlightener, and toner would be the same as your demi. Over to different colouring techniques that you'll need to use. These are all mapped over to the qualification again. Checking is the hair virgin hairs have been colour treated before. Here you'll write down the natural base. So it could be that you've got a regrowth client in. You may notice that the natural base of the root area could be 6. Levels of lift required. So that would depending on your target shade. So for instance, natural base could be 6. Your target could be an 8. So then your levels of lift required would be 2. The levels of lift of upper oxide strength would be in here. Identify any percentages of white, how long you can leave it on there for, and here you write up your formula. Again, we'll be covering formulas and things in a different video. And there's also the Aveda Pure Pro website, which you can register yourself on. I can tell you more about that in person. For your styling, so here we've got everything from part A, which is your blow dries. Then we've got all of our different types of setting techniques here from part B. Then we've got over to our shampoo units. So these are probably the ones you'll be filling in first. I expect you'll probably be doing 202 and 204 at the very beginning. And again, these are different types of scalp conditions you'll need to cover. You must cover 3 out of the 5, and the other 2 you can cover via oral questions. So that means that you must demonstrate to your assessor that you've covered, at least 3 of these different scalp conditions. But we would ask you, for instance, if you've done dandruff, oily and product buildup, your assessor would ask you, okay, can you talk me through what products you'd use if someone's hair was dry? That's that. Your different massage techniques here, these will be in your study pack for shampooing if you've not completed it already, as well as your different types of conditioning products. Surface is an everyday conditioner, and penetrating would be a treatment. And then obviously scalp treatment is different because, you know, we may be putting on something to treat the scalp, but that's not going to necessarily treat the hair. So you may use a scalp treatment and a penetrating in one. And then your conditioning massage movements. And again, these will be in your study pack. So this is the range of things there. Very important, once you've done your service, you get your client feedback and seeing if they're happy, get their signature, get a little bit of feedback from here. Your assessor will use this section to give you your feedback. So it could be well done, competent. If it is a competent assessment, your assessor will probably write see logbook, because they're not going to repeat two lots of writing, because there's also feedback in your logbook. Here you'll write your reflection, so how you felt you went and things you do differently. Obviously, if it's a competent assessment, you don't want to be too negative, because obviously you wouldn't have passed if not. Here you must write down what aftercare advice you recommend to your guest. So, you know, use damage remedy, shampoo and conditioner, come back in 4 to 6 weeks time, and that kind of thing. Your services, so you need to show where you're embedding maths and English. So if they've had more than one service, you're going to add it up here and put the totals in. And then finally, at the very end, you'll both agree when you're doing your feedback if you're competent or not. So your assessor would say, you know, well done, you passed your consultation today, passed your colour, and then they'll sign and date it here. This bit at the very bottom is if I'm sampling. So if I won't obviously check every assessment, but there'll be some assessments I'm checking the assessment process. So I'll be checking on, in this case, Alex assessing you. And then if that's the case, I would then fill that bottom part out. So it looks quite a lot. It's only 2 pages. And once you get into the habit of doing this, it will become much easier. So hope you find that useful, and I look forward to seeing you in the salon. Thank you.